Duchenne muscular dystrophy, DMD, is a rare and severe genetic disorder characterized by progressive muscle weakness and degeneration. It primarily affects males, as it is inherited in an X-linked recessive pattern. The disease is caused by mutations in the dystrophin gene, which is located on the X chromosome. Dystrophin is a crucial protein that helps protect muscle cells from damage during contraction. Without functional dystrophin, muscle cells become fragile and are damaged easily, leading to muscle weakness, loss of muscle function, and eventual muscle wasting. Genetic cause: Duchenne muscular dystrophy is caused by mutations in the DMD gene, which encodes the dystrophin protein. In a healthy individual, dystrophin acts as a shock absorber for muscle fibers, preventing them from being damaged during muscle contractions. In individuals with DMD, the dystrophin protein is either absent or non-functional due to mutations in the gene. This lack of dystrophin results in the breakdown of muscle tissue and its gradual replacement with fibrous tissue and fat. Over time, the progressive damage to muscle fibers leads to increasing disability. Because the DMD gene is located on the X chromosome, the condition predominantly affects males. Males have only one X chromosome, so a mutation in this single X-linked gene causes the disease. Females have two X chromosomes, so if one X carries the mutation, the second X chromosome typically compensates, making DMD extremely rare in females. Early symptoms: Duchenne muscular dystrophy usually presents in early childhood, typically between the ages of 2 and 5. One of the earliest signs is delayed motor milestones, such as late walking or difficulty running. Affected children may also show muscle weakness, particularly in the proximal muscles, those closest to the center of the body, such as the hips, thighs, and shoulders. One hallmark symptom is pseudohypertrophy, where certain muscles, especially the calf muscles, appear enlarged due to fat and fibrous tissue replacing muscle tissue. This can create the false impression of strength. However, these muscles are weakened and ultimately become non-functional over time. Another early sign is Gowers' sign, where a child uses their hands and arms to walk up their body from a squatting position to stand up. This occurs because of weakness in the thigh and hip muscles, making it difficult to rise from the floor without support. Progression of the disease: as the disease progresses, muscle weakness spreads to other parts of the body. By the age of 7 to 12, many children with DMD will have difficulty walking and may require a wheelchair. The weakness typically affects the pelvic girdle first and then spreads to the shoulder girdle and other muscles, including those responsible for breathing and swallowing. Over time, the loss of muscle function becomes more pronounced, leading to severe mobility limitations. By the teenage years, individuals with DMD may develop skeletal deformities, such as scoliosis, curvature of the spine, due to the weakening of back muscles. Most individuals with DMD lose the ability to walk by their teenage years and become completely dependent on others for daily activities. Cardiac and respiratory complications: one of the most significant aspects of DMD is its impact on the heart and lungs. The heart muscle can become weakened, leading to cardiomyopathy, a condition where the heart struggles to pump blood effectively. Respiratory muscles, including the diaphragm, also weaken, making it increasingly difficult for affected individuals to breathe. As a result, many people with DMD face respiratory failure and require ventilatory support as they age. Life expectancy: historically, individuals with DMD had a significantly reduced life expectancy, often not surviving beyond their early 20s due to complications such as heart and respiratory failure. However, advances in medical care, including ventilator support, cardiac management, and physical therapy, have led to improved life expectancy. Many individuals with DMD now live into their 30s and beyond, though they remain dependent on assistive devices and medical support. Diagnosis and management: the diagnosis of DMD is typically made through a combination of genetic testing and muscle biopsy. Genetic testing can identify mutations in the DMD gene, while a muscle biopsy may reveal a lack of dystrophin in the muscle tissue. Blood tests often show elevated levels of creatine kinase, an enzyme released when muscle fibers are damaged. There is no cure for Duchenne muscular dystrophy, but treatments can help manage symptoms and improve quality of life. Corticosteroids, such as prednisone, are commonly prescribed to slow the progression of muscle weakness. Additionally, physical therapy and assistive devices like wheelchairs can help with mobility. Cardiac and respiratory care are crucial for managing complications as the disease progresses. In recent years, gene therapies and exon-skipping drugs have shown promise in clinical trials, offering hope for potential future treatments that may slow or halt the disease's progression. Conclusion: Duchenne muscular dystrophy is a devastating genetic disorder with a profound impact on the lives of affected individuals and their families. While there is no cure, ongoing research and advancements in medical treatments offer hope for better management and, potentially, more effective therapies in the future. Early diagnosis, supportive care, and a multidisciplinary approach can significantly improve quality of life and extend lifespan for those affected by DMD.
Thank you for watching. Please subscribe our channel.